exactly location. Exactly. That you can walk on. Okay. I stand here. You just check that. You got.
If I that is center, no?
Like this.
Okay.
Use this one also.
Okay. Okay, good evening guys. Hope all you are preparing well for your tomorrow's examination. So in the today's session, the live session, so we are going to be discuss related to the preparation, okay, the last rapid revision preparation for the psychiatric nursing for the PBBSc and the 6th sem. So as you already know, so today we will discuss about mental health nursing, okay. So the rapid revision or the last revision session for your annual examination for the related to the mental health nursing. This will be includes or this will be include the both post basic basic nursing and the 6th semester of the basic nursing, okay. So in the today's live session, I will not. So first we will start with some people are joining. So okay, we'll wait 1 to 2 minutes. So once everyone will join, we will start. Okay, I will not delay. Okay, I will take only 1 to 2 minutes. Hope everyone are joining. So I can see the comments there. So one by one they are joining. Okay, so we will not to delay for the, because tomorrow you are having examination, so you need to prepare well for the examination. So we will not delay we will start the today session, okay. The one by one the students are going to be joining, so let them join. So we will start with our today's session, okay. So in the today's session, so we will see the related to the mental health nursing. So what are the major concept, okay. So the concept you can call the contents, okay. So the major concept are the contents which will be very important for your examination. We will see one by one, okay. So as you are also already went through your syllabus copies and you are also went to your old question papers and all. So just we will first recap, okay. First we will have the recap on the contents or the concept which will be very important for the examination, okay. So we will start with that one. The first thing we are going to be seeing in the introduction. Okay, so in the thing we are going to see in the introduction, so related to the concept of the mental health and the mental illness. Okay, so in the first introductory part of our psychiatry, So we are going to see the related to the concept of mental health and the mental illnesses. Okay, so this is a very important for your examination, the mental health and the mental illnesses, including this one. So in the first unit only we are going to be having some of the historical, how they are going to be developed. So first, just to go to that one, so that is not that much of the important we are going to be having in the examination, but so the definition, related to the mental health and the mental illness are very important. So with this one, so we are going to have the mental health program and the act. Okay, so in the first unit, so these are the main three, the concept we are going to be having. So the mental health and the mental illnesses and the related to the national mental health programs and the national mental health act. Okay, so these are the, apart from this, so there are the so many different topics are there. So like the functions of the mental health nurses in the different settings. Okay, it will be a clinical setting, it will be in the rehabilitation center, and it will be in the counseling and guidelines. So in the different settings, so what are the functions of the nurse we are going to be having and related to the mental health programs and the acts and the mental health and the mental illness. So these topics are the very important in your first unit. So that will be in the introduction. So whatever the concept you are going to be reading, so don't forget to cover these topics. Okay, so the whole syllabus what are the content, whole content is there, that will not possible to cover in only this revision. So that's I am going to be mentioning only the highlighting points. Okay, so whatever the highlighting points we are going to be mentioning here, don't forget to cover these concepts. Okay, so we'll move on to the second one. Okay, the second we are going to be moving. So in the second unit or the second the concept we are going to be having, so that will be the principles of mental health, okay, and classification. Okay, so the things what are going to be see in this one, so the very important will be the principle. Okay, so the principles of the mental health. Okay, the principles of the mental health, so this is very frequently asked question. Okay, so once you see your old question paper, so this principles of the mental health, okay, very frequently they are going to be asking this question, and related to that one, with that one, so we are going to have the important topic in this unit. So that will be the classification. Okay, the classifications of the mental health, that according to ICD-10. Okay, so so according to the ICD-10, so the classifications is also very important from this topic, and the principles of the mental health. Okay, the principles of the mental health and the ICD classification. So in that ICD classification, so we will comes to know how there is a total ICD from that what we are going to call F0 to F99. So this whole thing we need to be remember. So no. So in that one, so there are the important disease aspects are there. Okay, you know about that F0 to F9, like organic brain disorders. So whatever organic brain disorders will be there, that is a very important. So that one you need to be remember, and so the related to the F20 to F29, like schizo. Okay, schizo is nothing but schizophrenia. Okay, so related to the schizophrenia will be there, so that you need to be focus more, and related to the same the F30 to 39, like mood disorder, mood and affect, the mood and the affect disorders. Okay, so that classification will be there. So apart from that one, 60 to 69, the personality, and the 70 to 79 MR. Okay, so in the classifications of the mental health, so this ICD classification, so these factors, okay, these factors are the very the important you need to be remember, and including that one, so the principles. Okay, the including that one, the principles of the mental health. So that is also very important. So the apart from this, there will be a different concepts are there, like it will be the defense mechanism. Okay, DM is not nothing but diabetes mellitus. Okay, so DM is nothing but defense mechanism. So that is also one of the very important topic. So like that the other topics are there, but so when it comes to your examination, annual examination, the principles of the mental health and the ICD classification, so very important, and in that one, so these factors, okay, so these classification, so once you go to the in detail with related to the these concepts, okay, so this is about the second the topic or the concept we are going to be having, okay. So next we'll move on to the third one. So we'll move to the third topic, okay. So third topic will be related to the mental illness, okay. So in the third topic, so we are going to be related to the assessment of the mental illness, okay. What is meant by assessment? So for the disorders, like other disorders, we will having to have the there is a separation of the normal function like anatomy and physiology. So there we are going to have the physical examination, right? So we are going to do the physical examinations in the same way. So here also we are going to be having the mental status examination. Mental status examination, or you can call it as a MMSE. So that is mini mental status examination, okay. So this mini mental status examination is also very important. So when it comes to your annual examination, why? Because so this is also frequently asked question for both the post basic base nursing will be there and 6th semester will be there. So you can ask that, sir, the 6th semester first time we are going to be writing, so how you can tell frequently asked? So before this one, the third year basic psychiatry is there, no? So from that the concept, so we are going to having, so this is also very important in this assessment of the mental illness, okay. So apart from this one, so some of the psychological tests will be there and neurological tests will be there. So that one also you are going to be covering in this unit, okay. So apart from that, so this is very important for your 5 marks question for your annual examination. So this is we are going to see with the topic 3, so which is related to the assessment of the mental illness, okay. So you may get confused the topic numbers for the why, because so the session, okay, the session we are going to be having for both post basic base nursing and the 6th semester. So the topics numbers may change, but the concept will be same, okay, the concept will be the same. So that's the reason, so we will go by the concept wise, okay. So next we'll move on to the another concept, so that is a fourth, okay. The fourth concept, the very important, we are going to be having the therapeutic okay, the therapeutic nurse patient relationship, okay. So therapeutic, the nurse patient relationship, so we are going to be having the very again one of the important topic for your annual examination. So as we already having the older question papers and at the end of the session, okay, the one thing I will tell that, so after this discussion of the contents, okay, after this discussion of the content, by one of the very important surprising the reveal I am going to do that. So by analyzing or by predicting that the some of the important question I have made, okay, for the 10 marks, for the 5 marks and for the 2 marks, so which may direct, okay, the 90 to 95%, 90 to 95, this is the biggest thing I am going to tell, okay. So 90 to 95% that will reflect on your question paper, tomorrow's question paper, okay. So after this discussion of the concept, so we will go through that questions and all, okay. So before that one, so we will see the first concept. Okay, so in the therapeutic nurse patient relationship, okay, so we'll having the therapeutic the communication of the nurse patient relationship, okay, the therapeutic or the communication of the nurse patient relationship. So in this one, so the very important, okay, in this one the very important will be the phases. Phases are the phases of the nurse patient relationship, okay. So you already has there will be 4 phases are there, okay, the pre-introductory, orientary, working and the terminal. Okay, so that is a very important of the phases in the nurse-patient therapeutic relationship that is being asked the more time. Okay, the frequently, the so many times they are going to be asked in your question paper. Okay, so in the question paper and the questions we will discuss later. First we will see the related to the this. So therapeutic nurse-patient. So how the nurse-patient relationship has to be maintained between the psychiatric patients and the nurses. Okay, so related to that one, so these four phases, okay, they are very important. So you need to be must and should go through these concept. Okay, the must and should go to this concept. So apart from this one, so we are going to be having, so apart from this one, the one of the word that is a process recording. Okay, the process recording also we are going to be having in this topic only. This is also very important. Okay, the process recording means what? So how we are going to be collecting the data. Okay, so when from the day of the admission to the discharge. Okay, from the day of the admission to the discharge, so what are the things we are going to be collecting in the manner, so that will be, we are going to be process recording. Okay, so apart from, so the phase, okay, so whatever you are going to be study or not, these phases will be the very important for your examination. Okay, so this is about the therapeutic relationship. Okay, the next, so we are going to be having, so the next, the fifth concept we are going to be having here will be the some of the modalities. Okay, so some of the modalities we are going to be used in treatment aspect. Okay, so some of the therapeutic modalities we are going to be used in the treatment of the different psychiatric disorders. Okay, so in this the topic or in this chapter, so we are going to have the so many important the things. Okay, so that will be the antipsychotics will be there. Okay, the psychotherapies will be there. Okay, the antipsychotics will be there, the psychotherapies will be there, and some of the physical treatment modalities will be there. Okay, some of the physical treatment modalities will be there. So these will be the very important. So okay, when it comes to the antipsychotics, so we are going to be having the again the different classification. Okay, for the antipsychotics we will have the other classification like the manic will be there. Okay, the schizophrenia, for the schizophrenia we are going to have the different drugs will be there, the first generation, second generation drugs will be there, and there will be a anti-manic. Okay, so that is a mood stabilizing agents. Okay, the lithium and the carbonates. Okay, that will be there, so that whole will come under the antipsychotics. Okay, so this is a pharmacological, so we call it as a pharmacological. Okay, the pharmacological treatment modalities we are going to be, so that will be the antipsychotics will be there. Okay, so apart from this one, the psychotherapies. Okay, apart from this one, so the psychotherapies we are going to be having. So for this one there will be so many psychotherapies will be there. Okay, so it will be like family therapy will be there, occupational therapy will be there, group therapies will be there. So in that one, so the very the important will be there, millotherapy, family therapy. Okay, the very important, the family therapy is the very important. Okay, so apart from this one, the group therapy will be there, occupational therapy will be. So the one by one if you go, it will be a big lengthy. Okay, so this psychotherapy is also very important. Okay, so in that one, so this millotherapy. Okay, second. Okay, so in that one, this millotherapy is a very important. Okay, which will be based on the environmental factor. Okay, which will be based on the environmental factor. So this is a very important in these psychotherapies. Okay, so apart from that one, so we are going to have the physical treatment modalities. So like the ECT. So you know already about the ECT. Okay, so that is electroconvulsion therapy. The electroconvulsion therapy you already much more know about this one. So this is also again we are going to call the 3-star MCQ for your examination. Okay, the 3-star MCQ. Why being asked in the more? Okay, the frequently this is a very important the thing they are going to be asking in the examination. Okay, so the treatment modalities we are going to be using in the treatment of the psychiatric illnesses will be, the antipsychotics will be there, psychotherapy and the physical treatment modalities in this one. So here the mood stabilizing drugs and the first and second generation drugs for the schizophrenia are very, very important, and the Millu therapy. Okay, in the psychotherapies, the Millu therapy is also very, very important, and the last one will be the ECT. Okay, so that is also very, very important for your examination. Okay, so this is about the fifth unit. Okay, the next we will see the related to the related to the schizophrenia. So one of the very, very, very important, so we can call it as a 5-star also. There will be no any issue in that one by calling it as a schizophrenia. Why? Because so this one only we are going to call it as a the master of all psychiatric disorders. Okay, so this is the very, very important the disease we are going to be having in this one. The so many that very, very important things will be there, like so its classification will be there. Okay, the classification, the schizotypal, okay, schizoaffective. So like that, the classification is a very, very important for the schizophrenia. Okay, then the next, the clinical features. Okay, the clinical features for the schizophrenia is also very, very important. So in the clinical features, again we are going to have the positive signs and symptoms, the negative signs and the symptoms. So this is very, very important. Okay, the after the clinical feature in the treatment. Okay, in the treatment, so that will be the again the first generation drugs and the second generation drugs. Okay, so that is a very, very important, including this one. So this is the EPS. Okay, including this the EPS. Okay, so when it comes to when you are going to be start to study the schizophrenia, so if you want to make the well preparation, so in that one the classification must be included. Okay, the clinical features, so there will be some of the positive signs and symptoms will be there, negative signs and symptoms will be there. Okay, and so apart from that one, the diagnostic evaluation. Okay, so that will be there, anyway you need to there, but so very, very important. Okay, so the very, very important is about the classification, the clinical feature, the positive signs and symptom, negative signs and symptom. Okay, in the treatment, the first generation drugs will be there, the second generation drugs, and the last one. Okay, the EPS. So EPS is nothing but extra pyramidal symptom. Okay, the extra pyramidal symptom, so which we are going to be seeing when there will be a toxicity of the first generation. Okay, so when there is a toxicity of the drugs like the haloperidol, so we are going to be having the EPS. Okay, so this is why I am mentioning this is very, very important for the 5 marks or the 2 marks. Okay, if they are going to ask only simple the signs and symptom of EPS, so this will be the 2 marks. If they are going to be asked for the elaboration, okay, for the explaining of the EPS, so this will be the 5 marks question. Okay, so when you are going to be having the study on the schizophrenia, these the topics are the content is very, very necessary, which you do not skip any single wordings. Okay, the single wordings from these things. Okay, so this is about the schizophrenia. Okay, so the next we will move on to the another one, that is mood and the mood and the affective disorders. Okay, the mood and the affective disorders. So here we are going to having the mania, depression and the BPD. Okay, so in this one, so there will be a we are going to have the mania, depression and the BPD. Okay, so that is a very, very important. So the mania, so we are going to have the mania like the hyperactive symptoms. So it will be again based upon the duration. We are going to have the different based on the based on the duration. Okay, so the based on the duration, so we are going to have the different classifications for the mania. So like will be hypomania will be there, dysthymia will be there, cyclothymia will be there. So that terminology. Okay, so that this terminology will be very, very important for the 2 marks question. Okay, and the majorly here the signs and the symptom. Okay, the signs and the symptoms of the mania are also that will be very, very important for the 2 marks question. Okay, so the mania will relate it to the is main, it's a classification based on the duration and the signs and the symptom. So apart from this one, the treatment, okay, the treatment, that is a mood stabilizing drugs, okay, so that will be also very very important in the mania. And apart from that one, the lithium, one second. The lithium toxicity, okay, the lithium toxicity is also very very important when it comes to the mania, okay. So the drug of choice we are going to be giving, so that will be the lithium, okay. So the treatment we are going to be having the lithium. So apart from this lithium, so we are going to be having the different psychotherapies will be there, okay, in this one. So the lithium toxicity also very very important, so which frequently asked for your 5 marks question, okay. So and apart from this one, so we are going to have the depression, okay. So the depression again, it is also having the classification and the signs and the symptom, okay. The signs and the symptom also very very important. And the next will be the BPD, and here there will be the treatment, the drugs, okay. So SSRI, okay, that is selective serotonin reuptake inhibitors. So that is a very very important in the depression, okay, in the treatment aspect. And in the next will be the BPA, okay. So the bipolar affective disorder, where we are going to having both the mania plus depression, okay. So in the episodic wise, the both mania and the depression we are going to be having, okay. So this is about the very very important we are going to be seeing the mood and affective disorders, okay. So next we'll move on to the next unit. So next we'll move on to the next unit. So the it will be related to the, so it will be related to the personality disorders. Okay, so the next will be related to the personality disorders. So in that one, the classification and the signs and the symptom, okay. The classifications and these signs and the symptoms are very very important in the personality disorders, apart from the treatment aspect, okay. The treatment aspect will also important, but apart from this one, classification like cluster A, cluster B and the cluster C, okay. So that is very very important in the personality disorder and the signs and the symptoms. So these two factors you need to be must and should cover in your exam for your preparation, okay. So the apart from this one, so we are going to be having the eating disorders, okay. So apart from this, we are going to having the sexual disorders, okay. Apart from this, we are going to be having the sleeping disorders, okay. So apart from this, we are going to having the personality disorder, eating disorder, sexual disorder and the sleeping disorder. So this will be very very important for your 5 marks, okay. So from these topics, we are not going to be expecting for the 10 marks, okay. So this is also important, but so we need to have the, for the 5 marks, these will be the important topics, okay. So the eating disorders, so we are going to having bulimia nervosa and anorexia nervosa, okay. In the sexual disorder, so there will be a different sexual disorders will be there, and in the sleeping disorders also we are going to be having the different, okay. So insomnia will be there, somnambulism will be there, so like that the different will be there, okay. So for this this will be for the 2 marks and the 5 marks, these topics will be very very important. So must and should you also, you need to be cover these topics, okay. So the next important I am going to be the having, that is the organic brain disorders, okay. The organic brain disorders, okay. So this is also one of the very very important, so where we are going to having the dementia and the delirium, okay. The dementia and the delirium, okay. They are the very very important for the organic brain disorders, okay. So here we need to the very very important the things we are going to be, we need to see, that is the signs and the symptom, okay. So the dementia will be the dementia, so there will be a loss of the memory, okay, the forgetness of the memory. So in this one we will have the again different types of the dementia will be there, okay, the amnesia, the retrograde amnesia, anterograde amnesia, so like that the different classifications will be there, and related to that one the signs and the symptoms will be there, okay. So the next will be the delirium, okay, the delirium is all about the altered level of the consciousness, okay, the altered level of the consciousness, we are going to call it as a clouded consciousness, okay, the clouded consciousness. So this is also very important for the examination, okay. So these two also you need to be covered in your preparation, okay. So apart from this one, again one of the things we are going to be having, that is a neurotic disorder. Okay, so this is also this will be asked for your 5 marks or the 10 marks or the second. Okay. So sorry for the interruption. Okay. So the neurotic disorders. Okay. In the neurotic disorders, we are going to have the very important, like, okay, the anxiety disorders. Okay. The phobia. Okay. The anxiety we are going to be having. The phobias we are going to be having. Okay. So that will be the very important. Okay. The panic disorders will be there. Okay, the panic disorders will be there, general anxiety disorders will be there, phobias will be there, okay. So apart one of the important, that is OCD, okay. So this is again the 5-star MCQ, okay. So this one and the phobia will be again the 5-star, sorry, not MCQ. So this is for the for your 5 marks, and the for the 5 marks, the OCDs and the phobias are the very important. So in that one, especially in the phobias, the specific phobias, okay, the specific phobias will be the very important for the examination, like agoraphobia will be there, acrophobia will be there, nyctophobia will be, that is these specific phobias will be very important for the 2 marks question, okay. For the 2 marks, they will be the very important, and this OCD will be very important for your 10 marks and the 5 marks, okay. So for the 10 marks and the 5 marks, so this is 10 marks and the 5 marks for the post basic nursing, okay. For 6th sem, so for the 15 marks, okay. So you already know about your question paper, like it is having the 15 marks questions, the 5 marks, 2 marks and the multiple choice, okay. So for them, so this is very important for the 15 marks and the post basic, so for them it will be very important for the 10 marks, okay. So this one, the OCD, the must, and so this will be again we are going to have the classification like the obsession, okay, and the compulsion. So that much of the depth will not will have now. So just the OCD, the related to the OCDs. So what are the main signs and symptoms will be there? That things and the management. Okay, that's things and the management. So that will be the very important. And phobias, in that phobias specifically specific phobias. Okay. So in that one the simple phobias will be there, complex phobia. In that one especially the specific phobias will be there. That is very important when it comes to the neurotic disorder. Apart from this one, so we are going to have the DCD like hysteresia. Okay, that is also one of the important. So just you will going to look over that. Okay. So in the neurotic disorders, so we are going to be having these things. You must and should you need to be covered. Okay. So apart from, so we are going to have the another one important for your examination. So that is the substance use disorders. Okay. So the next will be the substance use disorders. Okay. So this is also very one of the important topic for your examination, both for the post basic will be there or for the 6th semester will be there. Okay. So this is also one of the very important. So in that one, so the 5-star I can give for this question will be the alcohol dependence syndrome. Okay. The alcohol dependence syndrome. Okay, so that is a very important for your examination for the 5 marks. Okay, or you may expect in the 10 marks also. Okay, so the what are the de-addiction, the drugs we are going to be using. Okay, what are the signs and symptoms? So once the individual has been de-addicted from the alcohol dependency, so some of the particular signs and symptoms will be there, like delirium will be there, the tremors will be there. Okay, the Wernicke's encephalopathy will be occur as a complications of the alcohol dependency. Okay, so like the signs and symptom, so that is the withdrawal symptom we are going to call. Okay, the withdrawal symptoms. So withdrawal symptoms also very important for your examination. Okay, so apart from this alcohol, so we are going to having the opioids will be there. Okay, the cannabis. Okay, the opioids will be there, the cannabis will be there. So like that, there will be a different the substances abuse disorders are there. So this is again one of the very important in that one. So they are going to be asked the role of nurse. Okay, so they are going to be asked the role of nurse in the alcohol dependency syndrome or the withdrawal symptoms. Okay, so the role of nurse in the patient with a opioid abuse. Okay, the substance abuse or the opioid abuse and the cannabis abuse. So like that they are going to be asking. Okay, so already the previously also they asked the end. So that's the reason. So I am going to give the 5-star for this topic. Okay, so the substance use disorders. Okay, so that is also very important. So apart from that one, so we are going to having the some of the like the childhood disorders. Okay, the childhood disorders will be there. Okay, that is also one of the important. But from this childhood disorder, so we may expect for the rarely 5 marks and the 2 marks, that is the very important. Okay, so in that one dyslexia will be there. Okay, the apraxia will be there. So like that, so there will be a 2 marks, especially for the 2 marks. So this topic will be the very important. Okay, so that will be the substance use disorders and the childhood disorders. So apart from this one, so we are going to be having the one of the very important for your examination, that is crisis interventions in psychiatric emergency. Okay, the crisis intervention and the psychiatric emergency. Okay, so this is also one of the very important. The frequently the questions has been asked from this unit. Okay, or the from this content. So there will be so many the questions has going to be asked. So here, so especially the role of the role of the nurse in the crisis intervention. Okay, so the role is the very important in the crisis intervention. Okay, so we'll see related what is meant by the crisis intervention. Okay, the 1, 2 to 3 point just we'll see related to the crisis. So whenever there will be some of the psychiatric emergencies. Okay, so here the types. Okay, the types of the psychiatric emergencies they are going to be asking. Okay, so again this is also one of the important questions. So whenever there will be a psychiatric emergencies occurs, so at that time, so what are the interventions we are going to be taking? Okay, what are the interventions we are going to be taking? And so in that one, the role of the nurse. Okay, in that one, the role of the nurse, what is the main important? So at the situation will be there at the during the emergency situation and the post emergency situation, what are the role? Okay, what is the role of the nurse? That is very important, and there is a frequently asked question. Okay, the role of the nurse in the crisis intervention. This is very hot topic. Okay, this is frequently asked. And the related here, the types of the what are the psychiatric emergencies are going to be occurring. Okay, so that will be in the case of the depression, the suicides will be there. Okay, so that will be we are going to be having. So apart from that one, there will be some of the panic attacks will be there, the catatopic stupors will be there. Okay, so then the next, the stress related to the stress, so there will be a sudden increase in the mania. Okay, so like the acute mania, so acute mania is also one of the emergency condition we are going to be having. So like in the psychiatric emergencies, okay, in the psychiatric emergencies, so we are going to be having, okay. So this is a very important, again I am telling, so whatever the topics you are going to be studying, but don't miss this one, okay. So if you miss this one, so this is a very loss you are going to be having in your tomorrow's examination, okay. So this is the one of the very important, okay. So apart from this one, so we are going to be having the last sorry for the interruption. So next we will see the one of the simple, okay, the simple concept, and that is not that much of the important for your examination. So that will be like the some of the ethical and the legal issues, and the so one of the topic that is a simple topic, that is community psychiatry. Okay, so the ethical and the legal issues. So here we are going to be having, we will see some of the, if there is any issues happens, okay. So when you are going to be dealing, okay. So when you are going to be dealing with a psychiatric patient, if there is any the issues that are going to be happening, so that we are going to be see with the ethical and the legal issues, okay. So has already the same this ethical and this the nursing the foundation of the nursing also we are going to see, but so the things again we are going to be seeing here, okay. This is also important, but therefore 5 marks 10 marks like that it will be no there. So just we are going to be having, and related to the community psychiatry, okay. So in the community level, so if you are a community psychiatric nurse, so what are the your role will be there, okay. The simple they are going to be asked for your role of the community health nurse, community psychiatric nurse. As a community psychiatric nurse, if you are having in one role, so that they are going to be asking, and that much of the not important these two, but don't forget to be C, okay. So these are the some of the very the important topics, so we have seen until now, okay. So in this one again, once again I am going to be tell, so the important whatever you are going to be study or you are going to be forgetting, the no matter, but the very important, like the once again I am going to tell Mental Health Act, okay, the mental health program from the first unit I am going to tell Mental Health Act, mental health program, the principles of the mental health nursing, okay. Then the next the classification, ICD classification, the therapeutic nurse relationship, okay, the therapeutic nurse relationship, and the antipsychotics will be there. The some of the therapies like family therapy, okay, milieu therapy, that is important. Then the next the complete, okay, the complete related to the schizophrenia, okay. The schizophrenia, don't skip the anything. The classification will be there, the signs and symptoms will be there, okay. The treatment modalities will be there, the whatever the things will be related to schizophrenia. So you see all, and don't skip the any even single the topic from the schizophrenia. And the next the mood and affective disorder, then the next organic disorder, organic brain disorder, dementia and delirium, and the especially the stress, what is that, neurotic disorders, okay. The stress will be there, anxiety will be there, phobia will be there, OCD will be there. That is a very these concepts are very important for your examination. So apart from that, the some of the minor concepts like the eating disorders will be there, the sleeping disorders will be there, okay. The childhood disorders will be there, the ethical and legal issues will be there, okay. So these are some of the minor, and one of the important, the crisis intervention, okay, the psychiatric emergencies. So that is also very important. So we are going to be having for your tomorrow examination. So do with these, okay, do confident with these topics, and don't skip the any topics whichever we have seen, okay. So now we are going to be see related some of the very important, so now we'll see related to the some of the important questions, okay. So initially I told after the discussion of these content, okay, after the discussion of these content, so we will see some of the very important the questions, okay, which will the affect, so the 90 to 95% which will be affecting your tomorrow's examination. Okay, so in the tomorrow's examination in the question paper, these questions you are going to be see. Okay, so such type of the questions I have made by seeing the old question paper and all, and what are the different topics are there. Okay, so we'll see one by one the questions and these questions. Okay, so this will be the some variations, so as you already know, for the 6th semester, so there will be a 15 marks question. Okay, the 2 questions will be there. Okay, and the next the 5 marks, the 4 questions, the 2 marks, the 4 questions, and the MCQ for the 12. Okay, so this is for 6th sem and PCBSC. So you are going to having 10 marks, the 5 marks, and the 2 marks. So already you know about the question paper pattern. Okay, the question paper pattern already you know about that. For the 6th sem they are writing first sem. Okay, the old question papers are not available for the as a applied secretary. Okay, before the mental health nursing are there, but for the applied you are not going to have the old question paper. So I have referred from both the old question papers of the post basic basic nursing and these. So these will be directly appearing in your tomorrow's examination. So for the PBBSc, the 10 marks will be there. Okay, 5 marks and the 2 marks. For the 6th semester, the 15 marks 2 questions, the 5 marks 4 questions, 2 marks 4 questions, and the MCQ will be the 12 questions. So based upon these things, so one by one we will see first. Okay, so with related to the 10 marks, okay, the 15 marks question for the 6th sem. So we are going to have the some of the list of the questions, so which they are being frequently asked also, and very important for that one. So in that one, so we are going to having like ECT. Okay, so already in the syllabus, so we have seen the related to the ECT. So here ECT, the indication and the contraindication. Okay, the indication and the contraindication of the ECT and the role of the nurse. Okay, so the role of the nurse in the ECT procedure. Okay, so what is the ECT? The electroconvulsion therapy. Okay, so that the indication, so we are going to be given in the psychosis patient. So already you know, so the majorly we are going to be using ECT in the treatment register schizophrenia, depression, okay, and the mania patients. Okay, so the contraindication for the ECT, like if they are having any brain injuries will be there. Okay, so then facial surgeries will be there in such individuals. So this ECT is going to be contraindicated. Okay, and related to this, so if you want to write, you can write the types of the ECT like direct ECT, indirect ECT, and the very important role of the nurse. Okay, so the pre, okay, during, and the post. Okay, so pre-ECT, what is your role? Like taking consent will be there. Okay, and the providing the loose cloths and whatever the vitals monitoring, that everything. Okay, the pre, during, okay, the during ECT procedure. Okay, the providing positions will be there and monitoring the vitals like the blood pressure, and the post. Okay, so what is the post care or the post procedure? What is the role of the nurse? Okay, so you write the ECT full form. Okay, and the indication. Okay, make the list of the indication and make the list of the contraindication, and especially the role of the nurse. Okay, the role of the nurse in the pre, during, and the post. Okay, so this is also very one of the important topics, the question we are going to be seeing in your tomorrow's examination, and this is the again the frequently asked question. Okay, so once you see if your question paper, so this will be there, and it is a very important. So apart from this, so we are going to be having the related to the mania. Okay, so in the mood disorders. Okay, so mania are in the mood disorders. Okay, the mood disorders. So here mania, the definition. Okay, so in the examination they are going to be they ask related to the mania, this types, the clinical features. Okay, the types, the clinical features, and the treatment. Okay, the treatment modalities, and the role of the nurse in the lithium toxicity. Okay, so this lithium toxicity is also again one of the important for your 2 marks also. Okay, So the lithium toxicity and I forgot, okay, the indication and the contraindication, okay. So this is the very important for your 2 marks, okay. So once we will have the 2 marks list also, there also we will see, but so here also the indications are separate. They are going to be asked for the indications of the ECT, the contraindications of the ECT, okay. So that is the 2 marks and whole ECT topic will be for the 5 marks, either for the 10 marks, okay. So apart from that one, the mood, okay, the mood disorders are the particularly they will be asked for the mania, okay. For particularly they will ask for the mania, the related to the treatment of the mania and the role of the nurse, okay. The role of the nurse in the if the lithium toxicity happens, so what will be the role of the nurse will be there, and the treatment in the role mania, the role of the nurses will be there. So this is also one of the important. So apart from this one, so we are going to be having, okay, so better will, okay. So we are discussing about 10 marks of the okay, the 10 marks are the 15 marks questions. So in that one, the next we are going to be having the define the crisis, okay, and the role of the nurse in crisis intervention, okay. So related to the crisis intervention, okay, the technique, okay, the role of the nurse and apart from that one, the techniques of the crisis intervention, okay. So this is very important, okay. So this has been asked in your frequently and this is a very important for your examination, okay. So the define the crisis and the techniques of the crisis intervention, okay. The define the emergency, the psychiatric crisis will be there, okay. The techniques of the crisis intervention and the role of the nurses in the crisis intervention, okay. So what is the role? So this is also one of the very important questions, so we are going to be having, okay. So apart from this one, so they ask about the admission and discharge procedure, okay. So this is also one of the admission and the role of the nurse, okay. The role of, so whatever it will be there, so you need to be write about the role of the nurse, okay. So the role of the nurse in the admission and discharge procedure, okay. The role of the nurse in the admission and the discharge procedure is also one of the very important question, so which may come or which may appear in the your tomorrow's examination, okay. And one thing I forgot to tell that, so whenever you are going to be write, okay, whenever you are going to be writing the disorders, okay. So whenever you are going to be write the disorders, so try to put the care plan, okay. So it will help you to gain the mark, especially when they are going to be asked for the 10 marks or the 15 marks, okay. So if they were for 5 marks left to you, okay, if you are having space there, it will left to you when they are going to be asked for 5 marks, but when the disease condition, okay, when the disorders, okay, when the disorders condition, they have been asked for the 10 marks or the 15 marks, okay, the 10 marks or the 15 marks, so must and should you put a care plan, okay. So if you are having the care plan there, so it will yield your marks, okay, it will be help to score the more marks in your examination, okay. So that is also one of the thing I forgot to tell in the mania only, but I remember now. So the whenever there will be a disorders in your 10 marks or 15 marks, so put the care plan as much as possible, okay. So this is the thing. Then the next, so the next, the 10 marks question we are going to be having about the therapeutic nurse patient relationship, okay. So this is very important for 10 marks, also even 5 marks, okay. For 5 marks also this is very important, and in this one the phases, okay, The phases is very important for the 4 phases will be there. The 4 phases will be there. That is very important for your 2 months. Okay. So in the therapeutic nurse-patient relationship. Okay. So how the relationship is going to be maintained in the nurse and the patient. So when the patient has come to admitted in the hospital, so how you are going to be a relationship will be there. So for that, to explain this therapeutic nurse-patient relationship, so we are going to have the 4 phases. Okay. So the pre-introductory, okay, the orientation phase, the working phase, and the termination. Okay, the termination phase. Okay, so this we are going to be having in the therapeutic nurse-patient relationship. The very important topic for your 10 marks or the 5 marks question. Okay, so apart from that one, so we are going to be having the substance abuse, okay, the disorders, okay, the substance abuse disorders. So that is also very important in that one, especially about the alcohol dependency syndrome. Okay, the alcohol dependency syndrome, in that one especially the clinical feature. Okay, the clinical feature of the alcohol dependency syndrome and the clinical feature of the withdrawal symptom or the withdrawal symptoms. So that we are going to be having here. So that is this substance abuse disorders. So that will be the very frequently asked question. And so here the role of the nurse. So in patient with withdrawal symptom or the alcohol dependence, so they may ask the role of the nurse. So explain the role of the nurse with the withdrawal, the patient with the withdrawal symptom, or the role of the nurse will be the alcohol dependent syndrome. Okay, so in this substance abuse disorder, this alcohol dependency syndrome is a very important. So the must and should you need to be study before going to your examination. Okay, so apart from this one, so they ask about the BPAD. Okay, so as already we see in the content only, the BPAD, the bipolar affective disorder, where there is a both combinations of the mania plus depression. Okay, in the episodic wise. So in the episodic wise, the mania and the depression, the both we are going to be seeing the BPAD. Okay, the bipolar affective disorder. So this is also very important. Here again the causes will be there. The causes, the clinical features are so the nursing management. Okay, the causes, clinical features and the nursing management, the patient with the BPAD. Okay, so that is the very important. So apart from this one, so we are going to be having the some of the again the important and the frequently asked question will be like. Okay, so the apart from this, so we are going to having the substance abuse act. Okay, the BPAD, then the next the therapeutic, again the therapeutic the nurse patient relationship, that is the very important. So apart from this one, the some of the crisis, so we already seen. Okay, the crisis emergency will be there, the some of the types of the psychiatric emergency, so that is also very important. And apart from this one, the again the last one of the important, that is the MR. Okay, this may ask. Okay, so this is also very important. So that MR is nothing but the mental retardation. Okay, so the mental retardation is also one of the very important. So here they ask about the classification. Okay, the classification of the mental disorders. So we are going to having the different mild, moderate, severe, profound. Okay, so that classification is there, very important, and the scorings will be there for that one. The range, okay, the ranges will be there. That is a very important. And the nursing management. Okay, the nursing management with the patient with the mental retardation. Okay, the nursing management with the patient with the mental retardation. So this is the very important. Okay, so for the 10 marks or the 15 marks question, so there will be a the first of all the important will be like the mood disorder, the like a BPAD, mania we have seen, and the crisis intervention with the psychiatric emergencies will be there. And the apart from that one, the mental illness, mental retardation will be there. Okay, this question and related to the phobias, related to the schizophrenia. So this will be the very important. So whichever we have discussed related to, till now related to the 10 marks and the 15 marks. Okay, so the next we will related to the 5 marks. Okay, so what are the important the questions that will come in your tomorrow's examination? So in the 5 marks, it is the principles. Okay, mental health nurse. Okay, or the mental health nursing. Okay, the principles of the mental health nursing. So this is a very important. Okay, so just they will give the elaborate or explain the principles of the mental health nursing or the mental health nurse. Okay, so that will be there. And national mental health program, the national mental health program will be there. Okay, and so here act, national mental health act. Okay, so that will also the one of the national mental health program will be there, act will be there. So this is also very important for the 5 marks. The principles of the mental health nursing will be there. This is also very important for the 5 marks. And the next, nurse patient therapeutic relationship. So as we are discussing the 10 marks only, I mentioned that the nurse patient relationship is also very important for the 5 marks. And again I am telling for the 2 marks the phases. Okay, don't forget the phases. The 2 marks, the phases, they are going to be mentioned, the phases of the nurse patient relationship. Okay, so that is for the 2 marks, and whole elaboration of the 4 phases in detailing, it is nurse patient relationship for the 5 marks. Okay, relationship for the 5 marks. So that will be there. And apart from that one, the preventive psychiatry. Okay, so apart from the one of the important, that is the preventive psychiatry. Okay, apart from that, the preventive psychiatry. So how we are going to be deal with the prevention of the mental illness. Okay, so in the prevention, so we are going to having the primary, the secondary, and the tertiary. Okay, so in detail I will not go. The primary, secondary, tertiary preventions. Okay, prevention of the psychiatry you can call, or you can tell about the prevention of the mental illnesses. Prevention of the mental illnesses will be there. Okay, so this will be also one of the very important for your examination. So apart from this one, so we are going to be having like EPS. Okay, so just they will mention EPS. Okay, the extrapyramidal symptoms. So this will be, if they ask only the mention the clinical features of the EPS, that is 2 marks question. Okay, just they ask about the EPS. Okay, that is extrapyramidal symptom. So that is also very important. And so the anxiety disorders will be there. Okay, so the phobias will be there, and the OCD. Okay, so whatever the neurotic disorders. Okay, so whatever the neurotic disorders will be, the anxiety will be there, OCD will be there, phobias will be there. Okay, so that is also very important for the 5 marks question. So apart from this one, okay, for the 5 marks, so mental health team. Okay, so what are the personals will be there? Okay, so the psychiatrist will be there. Okay, clinical psychologist will be there. The psychiatric nurse will be there. Okay, so the mental health team. Okay, the mental health team is also very important for the 5 marks question. Okay, and the next even they may ask about even ECT also. Okay, so ECT also they are going to be asked for the 5 marks. So that will be also very important. And so the dementia. Okay, the dementia or the delirium. Okay, the dementia or the delirium, that may not togetherly they will ask. Okay, so togetherly if they will ask, they ask about the organic brain disorder. So there you need to be explain the partially about dementia and the partially about the delirium. Okay, so they may ask about directly organic brain disorder. So apart from that, they are asked separately as the dementia, and the separately they are going to be asked for the delirium. Okay, so this is also very important for the 5 marks. So apart from this one, so we are going to be having the MR. Okay, so MR is also very important topic again for the 10 marks also. for the 5 marks also. Okay, so this one and the prevention. So already we have seen, right, that prevention of the mental illness, that I told now, prevention of mental illness, this is 5-star MCQ. Okay, so that prevention, primary prevention, secondary prevention, very very important. Okay, that is a very very important the question we are going to be having in the 5 marks. So apart from this one, so they may ask about the drugs like the the psychotics. Okay, so directly they will ask about the anti-psychotic drugs will be there. Okay, so like that they are going to be asked. So apart from that one, okay, so apart from that one, the lithium, the toxicity. Okay, the lithium toxicity also again they are very very important for the 5 marks. Okay, the lithium toxicity will be also very very important for the 5 marks. So apart from this, the childhood disorders. Okay, the childhood disorders will be there. The apart from this, the sleeping, the rarely they class sleeping or the eating or the sexual disorders. Okay, the sleeping or the eating or the sexual disorders that may ask. Okay, so that is also important. So once you go to these things, okay, so these questions, all other questions will be very very important for the 5 marks question. Okay, for the 5 marks this will be very very important. Okay, so next we will see related to the some of the very very important for the 2 marks. Okay, for the 2 marks there will be like so many questions. So in that one just we will have the one some analysis. Okay, so that will come to your or that will be reflected in your examination. Okay, for the 2 marks, so we will have the some of the list. Okay, so the in the 2 marks especially I am going to tell that for the 2 marks is a very very good thing. Why? Because so when you are writing with the 10 marks and the 5 marks, so that is a somewhat difficult to be get the marks there. Okay, so depending upon the concept you are going to be explaining, they are going to be give the marks. But when it comes to the 2 marks, okay, the direct, okay, whatever they asked you, so you just directly mention that. Okay, whatever they are going to be asked, you just, if you are right here for the 5 to 6 line also, means for accurate, if they ask the anyone, for example, if they ask the any dementia. Okay, so this is one of the defined dementia. Okay, if dementia means that will be a different. Okay, so define dementia. Okay, so what is mean by dementia? So like that they are going to be asked, define dementia. So dementia is one of the organic brain disorder where there is a loss of the memory. Okay, so that will be a partial loss of the memory, the complete loss of the memory for the shorter duration or the longer duration. Okay, for the longer duration, shorter duration, partial, complete, again we will have the different classification. But you just when you are going to be write the definition, so dementia is a type of the organic brain disorder which there will be a loss of the memory with respect to the shorter duration or the longer or partial or the complete the memory loss. So that is we are going to call as a dementia. So if you write that one and if you write the one of for easy scoring, you write better to write so some of the 2 to 4 the signs and the symptom. Okay, so for the dementia, so not only dementia, wherever they will ask for the definition. Okay, the dementia will be there, like or the delirium will be there. Okay, the phobia will be there, whatever they ask. Okay, whatever they will ask, so you write, try to write 2 to 4 signs and symptoms, so you will get the full 2 marks. Okay, so they ask definition, but also you need to be mention 2 to 4 the signs and symptoms. So if you know the even the treatment also, so if you write 1 to 2 line treatment also, there will be no any problem. Okay, so that is also for to get actually good marks. Okay, your total examination marks will be depending upon your 2 marks. Okay, so that the definition, the perfect definition you need to write the 2 to 4 signs and symptom, and if you know the treatment, the 1 to 2 line. Okay, don't elaborate here, don't elaborate. So whatever the specific is there, just go for the specification, so you will get the complete 2 marks. Okay, so this is the one example how to write the 2 marks. Okay, so in this one we will see what are the 2 marks questions will be there. So like, so in the 2 marks, so as we see like the delirium, okay, the dementia, okay, the delirium, dementia, just define delirium and the dementia. So that will be like that it will be there, and apart from that one, so some of the terminology, okay. I am not going to be mention one by one the terminology, okay. There will be a lots of the terminology where we are going to be see as the signs and symptoms of the disease disorders, okay. The terminologies will be there where we are going to be seeing the signs and the symptom like echolalia, echopraxia, okay. So and the next obsession, compulsion, so that two word things will be there, akathisia. Then the next in that one, the terminologies whatever will be related to the disorders, okay, that will be the very important. The terminologies, the signs and symptom of the disorders. So you need to be must and should, okay. So in that one particularly I am going to refer that the vaccine flexibility, the vaccine flexibility. So it is one of the signs and symptom, okay. It is a signs and symptom of the which one? Schizophrenia, okay. So this is the direct they will ask vaccine flexibility. So you need to write. So it is one of the signs and symptom of the schizophrenia where the patient is going to be stay in the single position for the longer duration of the time. So that is vaccine flexibility, okay. So like that it will be there, and apart from this one, the defense mechanism, okay. So in the defense mechanism there will be lots of the defense mechanisms are there, okay. So like repression will be there, okay, displacement will be there, suppression will be there, like that. The so many reaction formation, so you know about that, okay. So that defense mechanism. So anyone, okay, so anyone they will ask, okay, not whole defense mechanism they will ask, anyone the defense mechanism they are going to be asked, but you should need to know about what are all the defense mechanism, what are that, okay. If possible for the defense mechanism, if you give the example also, it's a very well and good, okay. The defense mechanism is also very important. And apart from this one, the two words, the delusion and its types, okay. So this is also very important, okay. The delusion and the type mention what is mean define delusion and its types, okay. Then the next the term hallucination, okay. Then the next illusion. These three, okay. The delusion will be there, hallucination will be there, illusion, okay. So the definitions of the these things with example will be the high chance of appearing in your examination, okay. The delusion, hallucination and the illusion, okay. So that will be the very important. And apart from that one, so they will may ask the mention the 2 or the 4 the antipsychotic drugs, like that they are going to be asking, okay. So the antipsychotic drugs they will ask, and or apart from that one, so that is they particularly ask first line drugs or the second line drugs for the schizo, okay, for the schizophrenia, okay. So that they are going to be asked the first line drugs and the second line drugs will be there, okay. So apart from this one, so here only the positive and the negative symptoms. So that is also very important for the 2 marks. The positive and the negative symptoms of the 2 marks, and in the schizo only the symptoms of the EPS, extrapyramidal symptoms, signs and symptoms of the EPS. Okay, this is also very important for the 2 marks. Okay, so these all the things. So whatever we have discussed from the contents. Okay, so till now the very important the contents where we have been discussed. Okay, so what are the important topics will be covered, need to be covered for the examination, so that contents will be there. And so apart from that one, the 10 marks. Okay, the 10 marks, the very important 10 marks will be there, and the 5 marks questions and the 2 mark questions. Okay, the 2 mark questions. So that will be the these are the things. So in the today's we have been discuss. So before ending the session, okay. So before ending the session, so I want to tell about how to write one and even of the 10 marks exam, okay. So all people's, the students, okay, has been more struggling to write the 2 marks they will write, okay, 5 marks, whatever they will write. So for the, especially for the 10 marks, how they need to be covered, okay, how they need to be cover the content in the examination, okay. So if they ask on simple example, so if you are going to take the as a BPA, okay. So if this is a just example how to attend the 10 marks question, okay. So if for the PBBSc the 10 marks question, or if it is for the BSc 15, so I think in the 15 they are given by as a and the B, okay. They will give the A and the B, okay. So in this one the BPAD, okay. So the bipolar affective disorder, if they ask the explain about BPAD and its nursing management, okay. So if they ask the question about the explain BPAD and its nursing management, so how you need to be attend this question, okay. So first you need to be write the expansion of this one, okay. First you need to be write the expansion of this topic, that is the bipolar affective disorders, okay. Then the next you need to be write, so the disorders which will be there, so by in the form of the definition, okay. So first you need to be expansion, you write the expansion of that one, bipolar affective disorder. Then the next you need to be write, so what are the disorders are there in the definition, okay. Bipolar affective disorder, so this is the combinations of the both the mania and the depression, okay. So like that, and you need to be write separate as a what is the definitions of the mania, the hyperactive of the individual and the depression, okay. So related to the definitions of the mania you need to write, definitions of the depression you need to write. So with that one, so next we will move on to the causes, okay. So the causes, so what are the causes will be for the BPAD, okay. So that will be some of the genetical causes will be there, okay, some of the hereditary causes will be there, and for especially for the depression, okay, some of the environmental causes, seasonal causes will be there, okay, and some of the childhood traumas will be there. So like that there will be a different causes will be there, okay. So that causes you need to be mentioned, okay. The expansion, the disorders in the form of the definition. Then the next you need to be mention about the causes, okay. After causes, so you go for the clinical features, okay. The now question, okay, how to rate the clinical feature. So here both the BPAD is there, okay, bipolar affective disorder, the both it will be there. How we need to be attend this one, okay, how we need to be attend. So here better to write the mania and the depression has a separate, okay. The mania has a depression separate, and you write the clinical features of the mania and clinical features of the depression, okay. So if you are writing like that, it will be very well and good. Or if you write that togetherly also, there is no problem, okay. So togetherly if you write the hyperactiveness, then the next social withdrawal, the next what it will be there from the suicidal tendency, okay, like that it will be means it will mixing, it will not good, okay. So if you write the mania and the depression has a separate, okay, so hyperactivity will be there, okay, in this one. Then the next the more the overactivity will be there, delusion of the grandiosity will be there, okay, the thought altered disturbances will be there, okay, the suicidal in here the suicidal tendency will be there, okay. So like the aggressive behavior in the case of the mania, okay, the social isolation in case of the depression. So if you write as a separate, it will be very well and good, okay. So that is about the clinical features. So the next, the diagnostic evaluation, so it will be based on the mini mental status examination and based on the clinical feature has been observed, okay, based on the clinical feature has been observed, okay. And the next, the last one will be the treatment. So when it comes to the treatment, okay, so the BPAD is nothing but, so especially I took very nice, okay. So here we are going to cover the two disorders also, okay. So when it comes to the treatment of the BPAD, so first we need to be in the treatment, okay, when you are going to read treatment, you can write directly as a mood stabilizing, okay, the mood stabilizing drugs will be there, okay. Then the next antidepressants will be there, antidepressant, okay. So this is the major to the pharmacological treatment. Okay, the major to pharmacological treatment for the BPD. So in the mood stabilizing drugs, so that will be lithium carbonate. Okay, the lithium carbonate will be there, and here antidepressant. So we are going to having the SSRI will be there. Okay, MOA will be there, TCA will be there. So like that, there will be a different classification. So that you write, and you write the psychotherapies. Okay, so some of the psychotherapies will be there. Whatever the important the psychotherapy which we are going to be using here will be there, like CBT, the BT, and the next. So group therapy and environmental or the myelotherapy, especially for the depression. Okay, the change in the environment for the depression. So like that, the psychotherapies also we are going to be using in case of the BPA. Okay, so when this is about the treatment. So the next you need to be write about the nursing management. Okay, so the nursing management. So the nursing management. Okay, so in the nursing management, so related to the first the thing, so in the patient with especially the depression, the observation is a very important. Okay, so not only in the depression, has been a nurses. Okay, the observation is a very important skill we need to be have for our the things. Okay, so in the nursing management, so for the observations of the patient and the analysis. Okay, assess for the suicidal risk. Okay, suicidal risk in case of the depression patient. Okay, suicidal risk for the depression patient will be there, and the monitoring the vital signs. Okay, the monitoring the vital sciences will be there, and assessment of the nutritional status. Okay, so assessment of the nutritional status, very important. Why? Because then the both condition of the mania and the depression. Okay, then the both condition of the mania and the depression, the nutritional status will be altered. So in the mania, due to hyperactivity, the patient will not sit in the particular place and he will not eat, and in case of the depression, he is going to be avoiding. Okay, in the depression he will completely avoiding, even so society is nothing but, so the food also he is going to be avoiding. So here the assessment of the nutritional status is very important. Okay, so the like after this one, the administration of the medication will be there, and providing the therapies, group therapy will be there, whatever the things will be there. So the nursing management you need to be right. Okay, so as if it was 5 marks, so if you are up to cover here, it will be okay. So if you are going to write for the 10 marks, okay, if you are going to be write the 10 marks, so let's we'll go for the some of the nursing diagnosis. Okay, the nursing diagnosis. So you need to be write the any 1, 2, like the altered body balance. Okay, sorry, the nutritional balance. So altered nutritional balance due to the disease condition has evidenced by the appearance. Okay, so that nutritional related to the nutritional status, you can write one of the nursing diagnosis. Okay, so altered body nutritional status has evidence due to the disease condition has evidenced by the observation, or the has evidenced by the observation. And the next, or the has evidenced by the food refusal. Okay, what are the clinical features you can write, no problem. And the next, so the risk for injuries. Okay, so in case of the mania, if the patient is in the manic phase, okay, if the patient is in the manic phase, the risk for the injury and the risk of the suicidal tendency. Okay, the risk of the suicidal tendency. So like that, you make the list of the 3 to 4 nursing diagnosis. You make the list. Don't write the nursing diagnosis like this. Okay, so you write full. The risk for suicidal tendency due to the disease condition has evidenced by the clinical feature. Okay, so what are the clinical feature, like social withdrawal will be there. Okay, avoidant behavior will be there. So like that, you need to be right. So write the 3 to 4 nursing diagnosis. Then the next we will go for the nursing care plan. Okay, so the next will be related to the nursing care plan. Okay, so you already know you are having the 5 factors like the assessment, okay, the diagnosis, the planning, okay, the implementation and the evaluation. Okay, so put the tabular column and write the assessment, the subjective and the objective data, the subjective and the objective data. So write the nursing diagnosis and write what are the plannings you are going to be do and how you are going to be implement that one. Okay, then at the last, so you need to be evaluation. Okay, so this is one of the model to how to write the 10 marks question to get the nice score in the examination. Okay, so by this, so I am going to be concluding, I am going to ending this class. So by concluding that, there will be a 5 marks, 10 marks and the 2 marks. In that one especially, the psychiatry is like short, okay, the short and sweet, we are going to call it as a short and sweet subject. So prepare well, okay, what are the contents we have been discussed and what are the important questions we have been discussed here. Make the one side list and you must and should, you need to be cover what are the contents we have done and what are the questions we have done here for the tomorrow's examination. Okay, so by this we will conclude the today class, and once again all the best for your tomorrow's examination. Do well, write well and leave happily. Okay, thank you.